Hello, my name is Dr. Alieta Eck. I'm an internist in private practice in New Jersey. I'm one of a growing number of physicians who is very concerned about where our country is headed in the area of health care. This is May 1997, but in May of 1962, a drama was unfolding where a president was advocating increased involvement in the paying of health care bills, while a physician was voicing a word of caution. The president was John F. Kennedy, and the physician was Dr. Edward Annis, a general surgeon from Miami. Dr. Annis later became president of the AMA and the World Medical Association. He has written the book entitled Code Blue: Healthcare in Crisis. Just like today, in 1962, there was a push for the socialization of medicine. It was clear that there were poor elderly people who could not afford health care or insurance. So as President Eisenhower was leaving office, he passed a bill called the Kerr-Mills Bill. This was a program that would provide for the needs of the poor elderly and required that people submit evidence of their inability to pay. There was a movement afoot to extend this medical care to all the elderly. The reasoning was that since medical care is a right, no one should have to prove he needed help paying for it. When President Kennedy came to power, Congress introduced what was called the King-Anderson Bill. This was the first major irreversible step toward the complete socialization of medical care. The King-Anderson Bill was never insurance, but a forcing of one segment of our population to underwrite the payment of health care for another, regardless of need. The Democratic Party decided to make the King-Anderson Bill the major legislation that they would push. 5,000 public speeches were planned across the country in the spring of 1962. An atmosphere of national crisis was contrived as press coverage, radio and television, and leaflets were distributed. The campaign would culminate with a nationally televised address by President John F. Kennedy in New York's Madison Square Garden on May 20th, 1962. The hall was to be packed with the Union's National Council on Senior Citizens and would be carried live on all 3 television networks, free of charge as a news event. Let's take a look back to Madison Square Garden in 1962. President John F. Kennedy is beginning to speak.
I come to New York because I believe the effort in which we're engaged is worth the time and effort of all of us. I come from Boston, Massachusetts, near Faneuil Hall, where for a whole period of years, meetings were held by interested citizens in order to lay the groundwork for American independence. And while there may be some who say that the business of government is so important that it should be confined to those who govern, in this free society of ours, the consent, and may I say the support of the citizens of this country is essential if this or any other piece of progressive legislation is going to be passed. Make no mistake about it. We say that during his working years, he will contribute to Social Security as he has in the case of his retirement, $12 or $13 a month. When he becomes ill, or she becomes ill over a long period of time, he first pays $90 so that people will not abuse it. But then let's say he has a bill of $1,500. This bill is not that we're talking about Mr. Anderson's bill and Mr. King solve everything, but let's say it's $1,500, of which $1,000 are hospital bills. This bill will pay that $1,000 in hospital bills. And then I believe that he and the effort he makes in his family can meet his other responsibilities. Now that does not seem such an extraordinary piece of legislation 25 years after Franklin Roosevelt passed the Social Security Act. There are doctors in New Jersey who say they will not treat any patient who receives it. Of course they will. They are engaged in an effort to stop the bill. It is as if I took out somebody's appendix. The point of the matter is that the AMA is doing very well in its efforts to stop this bill, and the doctors of New Jersey and every other state may be opposed to it, but I know that not a single doctor, if this bill is passed, is going to refuse to treat any patient. No one would become a doctor just as a business enterprise. It's a long, laborious discipline. We need more of them. We want their help, and gradually we're getting it. The problem, however, is more complicated because they do not comprehend what we're trying to do. We do not cover doctors' bills here. We do not affect the freedom of choice. You can go to any doctor you want. The doctor and you work out your arrangements with him. We talk about his hospital bill, and that's an entirely different matter. The point of the matter is that this meeting and the others indicate that the people of the United States recognize, one by one, thousand by thousand, million by million, that this is a problem whose solution is long overdue. And this year, I believe, or certainly as inevitably as the tide comes in next year, this bill is going to pass. This bill serves the public interest. It involves the government because it involves the public welfare. The Constitution of the United States did not make the President or the Congress powerless. It gave them definite responsibilities to advance the general welfare, and that is what we're attempting to do. I visited twice yesterday and once today, a hospital where doctors labored for a long time to visit my father. It isn't easy. It isn't easy. He can pay his bills, but otherwise I would be. And I'm not as well off as he is. I understand that there's going to be a program this week against this bill in which an English physician is going to come and talk about how bad their plans are. It may be, but he ought to talk about it in England. Because his plan and what they do in England is entirely different. In England, the entire cost of medicine for people of all ages, all of it, doctors, the choice of doctors, hospitals, from the time you're born to the time you die, are included in a government program. But what we're talking about is entirely different. And then finally, I had a letter last week saying you're going to take care of all the millionaires and they don't need it. I do not know how many millionaires we are talking about, but they won't mind contributing $12 a month to Social Security. And they may be among those who will apply for it when they go to the hospital. But what I will say is that the national government, through the tax laws, already takes care of them, because over 65 they can deduct all their medical expenses. But I refuse to see us live on the accomplishments of another generation. I refuse to see this country and all of us shrink from these struggles, which are our responsibility in our time, because what we are now talking about in our children's day will seem to be the ordinary business of government.
Requested equal time, but all three networks refused, saying that theirs was a partisan political message. The ingenious decision was made to rent out the garden after all the people had left, to allow Dr. Edward Annis to deliver his rebuttal. The President of the United States, followed by your family doctor. Dr. Edward Annis stood before thousands of empty seats and delivered his address. It turned out that he had one of the largest television audiences on record up to that time, over 30 million viewers. Now let's see what Dr. Annis had to say.
Men and women of America, I appeal to your sense of fairness. Nobody, certainly not your doctors, nobody can compete in this unfamiliar art of public persuasion against such massive publicity, such enormous professional machinery, such unexplained money, and such skillful manipulation. Of course it's unfair when the proponents of King Anderson, by having the President address their rally, get their story and their show televised all over 3 networks, free of charge, as a news event. Of course it's unfair when your doctors, asking for equal time to make reply, got turned down and have to pay for a half hour on one network to tell you the other side of the story. Unfair, yes, not to us so much, but to you. We doctors fear that the American public is in danger of being blitzed, brainwashed, and bandwagoned into swallowing the idea that the King Anderson bill is the only proposal, the only program that offers medical care for the aged, that there is nothing else. Well, let's put that outrageously false idea on the bandwagon and send it back where it came from. Just 2 years ago, your Congress in Washington enacted into law the Kerr-Mills Medical Aid to the Aged program. The Kerr-Mills law has already been accepted by 38 states and is being considered by others. It's on the books. It's a brand new national law. Why aren't you hearing more about it? It works. The American Medical Association and most doctors in this country supported and do support the Kerr-Mills law because we see it as a desirable supplement to one of the greatest social advances of our generation. I mean the spectacular growth of private voluntary health insurance systems to which millions of Americans already belong. Of our 17 million people past 65, over half, 53%, or 9 million, 3 times as many as 10 years ago, already are covered by some form of voluntary health insurance or a prepayment plan. This is a spectacular forward movement. Insurance actuaries estimate that by 1970, 80 to 90% of the aged will be covered by private programs. Of course, there will always be a number of people who are truly indigent or who just cannot pay for their medical needs. That is where the Kerr-Mills Medical Aid for the Aged law comes in. Please, do not be blinded by the scare words of propagandists. Now let us make an X-ray examination of what they are attempting to sell you. The King-Anderson bill. Let's find out what all the cheering was about. At the same time, you'll find out what this fight is about. Here it is, the King-Anderson bill, H.R. 4222. Yesterday, you heard the President say, well, no, let's listen to his own words.
Well, let's hear what some people say. First, we read that the AMA is against it, and they're entitled to be against it. Though I do question how many of those who speak so violently about it have read it.
Well, the President may question that we've read this bill, but I will gladly leave the answer up to you as to whether we've read it. Instead of singing along with Mitch, suppose you read along with me. First, I read the title, the Health Insurance Benefits Act. Is it genuine insurance? No, it is not. The Supreme Court has held more than once that the Social Security system is not an insurance system. It is the way we have chosen to cushion the general economic needs of old people in this country. The Social Security tax, collected from those under 65, pays benefits to those over 65. Why not be honest about it? I say any health program that calls itself insurance and isn't has to be bad to begin with. And what about those who would be covered? Meaning everyone over 65 eligible for Social Security. That means everyone, the rich, the well-to-do, and the comfortable, as well as those of low income, whether they need it or not, whether they want it or not, they'd be in. The American taxpayer, whose payroll tax would be hiked by as much as 17% to start with, in order to pay for this program, certainly has a right to question the free ride those who do not need these benefits would be taking at the expense of his children. This bill would put the government smack into your hospitals, defining services, setting standards, establishing committees, calling for reports, deciding who gets in and who gets out, what they get and what they don't get, even getting into the teaching of medicine, and all the time imposing a federally administered financial budget on our houses of mercy and healing. Ladies and gentlemen, this King-Anderson bill is a cruel hoax and a delusion. It wastefully covers millions who do not need it. It heartlessly ignores millions who do need coverage. It is not true insurance. It will create an enormous and unpredictable burden on every working taxpayer. It offers sharply limited benefits. It will undercut and destroy the wholesome growth of private, voluntary insurance and prepayment health programs for the aged, which offer flexible benefits in the full range of an individual's needs. It will lower the quality and availability of hospital services throughout our country. It will stand between the patient and his doctor. And it will serve as a forerunner of a different system of medicine for all Americans. If our government wants to move toward welfare state medicine, let them tell us so honestly. Why sneak it in piece by piece on the backs of old people first? The King Anderson crowd intends to take us all the way down the road to a new system of medicine for everybody. And don't mistake it. England's nationalized medical program is the kind of thing they have in mind for us eventually. Today, after 14 years of national medicine, more and more people in England are buying private health insurance, on top of paying the heavy compulsory tax for government medicine which they don't use. These people want private medical care. That's what we have here. The people have a right to remind their first servant that his election, even his present popularity, does not authorize him to change fundamental institutions that have proved their lasting value through the generations. Nor should he tamper with fundamental human relationships which are sacred in that they involve the creation of human life or the preservation of human life. There are few such things which touch so close to God. And the relationship between a doctor and his patient is one of them. All of you who occupied these 18,000 seats yesterday, you are at home now. You have time to think. You have time to ask your doctor. To the millions of Americans who may have a doubt, who may want to take a moment to hear the views of one they know and trust, I implore you, ask your doctor. Ask your doctor. Thank you.
On July 17, 1962, the votes were cast. King Anderson lost with a vote of 52 to 48, largely because of the efforts of Dr. Edward Annis. Then came the assassination, and President Johnson was able to institute his Great Society in the name of our martyred president. King Anderson this time swept through Congress, and the program that is now called Medicare was born. Dr. Annis, now 83, remains an articulate spokesperson for freedom in medicine. We are privileged to have him with us here today. Please welcome Dr. Edward Annis.
Well, they said we were wrong. I had the opportunity to meet with President Kennedy in the Oval Office. And
He was truly prophetic. These handouts that will show a little bit, I'm going to give you a little bit of the history of how we pay for health care. It has gotten more and more expensive, and are we getting values for the dollars we spend on medical care? There are those who would like to keep the public confused, to blame doctors for the escalating cost of medicine. Physicians order too many tests, do not order enough tests. They don't use their EMRs properly. They upcode with them, they downcode with them. They're all swayed by the pharmaceutical industry to order expensive medicines. It's always the physician's fault. And recently, members of the Board of Internal Medicine have stated that physicians are not really good at making timely diagnoses. The answer is to take us away from our practices, charge thousands for review courses and the privilege of taking their tests, and then spoon-feed us information that's 2 years out of date so that we can recertify in whatever specialty we're in. Are these really the costs of the causes of the high cost of medical care? I want to start with what's simple. A doctor who works directly with his patients. It's hard work. A doctor spends years of training. Finally, he's ready to begin to earn a living. And if he wants to start a private practice, he has to use his private savings, get help from his family, take out a loan, find an office, fix it up, equip it, hire staff, and begin to see patients. And his income comes from private fees, or insurance payments, or any government programs he might have gotten involved with. But from that income, he has to pay off his loans. He has to pay his rent, office overhead, salaries, medical malpractice insurance, and finally, when he's paid all his bills, he keeps what's left over. In private practice, the physician has the greatest degree of autonomy and freedom to practice the way he chooses. He's working directly for his patients. He has to keep them satisfied. And if he charges too much, there might be somebody nearby that could charge less. So he can't really overcharge in that regard. He has to be available, skilled, knowledgeable, competent. And it's really the Marcus Welby scenario. When I realized when I talked to my son, he didn't know who Marcus Welby was. That was a sitcom in the 60s, and it was a doctor who knew his patients, knew the family, attended funerals, attended weddings, and just was kind of the family doctor that people grew up with and loved. Anyway, medicine practiced that way is very satisfying. Doctors in private practice earn an honest living. It's honest, hard work. There's no hidden income, and if the free market works well in private practice. It was the way most physicians practiced. Until 2005, 2/3 of doctors were in private practice. And it's estimated by next year, only 1/3 will be in private practice. But that's not the only sector that's changed. I'd like you to look at hospitals 50 years ago in 1962. Most hospitals were started with philanthropic donations, corporate donors, community fundraisers, and the income was direct payments from their patients or their insurance companies. The bills were simple, they were understandable. Hospitals were named St. Barnabas, St. Peter's, Long Island Jewish, and so forth, and they were started by people of faith. Hospitals had many volunteers, candy stripers. They added a touch of, a human touch. There were no government funds, no federal government funds at that time. Some hospitals were built and funded by counties in large cities, and they cared for the poor and the uninsured. I went to medical school in St. Louis, and there was St. Louis County Hospital, there was a city hospital. There were residents and nurses in training, and we took care of patients, we learned a lot, and we took good care of the patients. But everything was low budget, and the hospitals served their purpose. The local taxes funded the community hospital, and they were a source of pride in the community. They were run by physicians who were just maybe recently retired, and that physician would make about the same as he'd made in his last year of work. Not like now, when it's a huge multi-million-dollar salaries that the CEOs of the hospitals make. The hospital fees were based on the free market and the actual cost of providing care. And if any funding came from the government, it was all local. The average hospital stay was $100. Now, interestingly, in 1962, the average family income was $5,600. So that sounds like a multiple of 10. If we would go with today, it shouldn't cost more than $1,000 for a visit, for a hospital day in the hospital. And actually, it's $3,000 to $5,000 or more. So something has gone home. What has happened? People would like to blame technology, but you know that doesn't make sense. Because in every other sector, technology gets less expensive as there's more people that have access to it, prices go down. Why not so in medical care? I remember when a calculator you would buy for $1,000, a little handheld calculator, and it was like such an anomaly. But now you can pick one up for $10. So profits tend to make costs go down, and finally lower profit because they lead, lower prices because they lead to competition. Biggest difference between 1962 and today is the massive infusion of federal dollars. And that's what we were talking about with what Dr. Annis was talking about, and JFK could not foresee. How are hospitals funded today? Well, very few people can understand the bill, much less pay them. The hospitals collect huge amounts from high health insurance policies. They collect them from Medicare and Medicaid, and then the states will provide subsidies for uncompensated care. The health insurance premium has skyrocketed, largely due to the influence of government. In New Jersey, we have actually had Obamacare since 1992, and the premiums are $2,000 to $3,000 a month in New Jersey. So you just wait. The rest of you states, you'll find out. Because they have guaranteed issue and community rating and all those things that they're trying to push with Obamacare. There's a great deal of obscurity, and that's what I say on the bottom there. It's a false economy, very little transparency. Hospitals are constantly crying poor. The executives reap millions in salaries and benefits. The politicians favor hospitals. They give their friends and relatives onto the payroll, and how much winds up in those politicians' pockets is anybody's guess. We can't paint every hospital that way, but those who are not involved in the free market, I hold suspect. Well, here's another fact. For some reason, when a hospital bills for the exact same service, they get more for it. An article in the Wall Street Journal in August spoke of a patient who found that his insurance paid $1,605 for a heart scan in his doctor's office. And a year earlier, the exact same test was done for only $373. The doctor's practice had been bought up by a hospital system, and the hospital system could use its clout to get higher payments for the same service. Everybody pays more. Employers pay more for health insurance policies when that scenario takes place. Medicare pays more for doctors when the service is billed by the hospital. So the same service is the same CPT code. The doctor would get $70 and the hospital gets $124. Hospitals claim that by employing physicians, they could eliminate duplication, improve coordination, reduce hospitalization with more proactive management of patients. It's probably that hospitals are just bigger bullies and they're able to collect more and use their clout. And as they consolidate and get more and more into bigger entities, sure enough, they're monopolies and they can charge more. So back to hospitals of today, more and more physicians are finding that they could sell their practice to the hospital, not worry about paying overhead, and just come away with a salary. And that sounds very, very tempting to the doctors. Doctors don't have to worry about collecting the fees. They don't have to worry about making payroll. All they have to do is show up. They might be ordering more or less tests depending on how the hospital is paid for the test. But they're no longer working directly for their patient. They're working for a hospital. And their salary is now dependent on the hospital. Pressures are applied. The doctors find that they lose control. They can't go on vacation when they please, and more importantly, they're not free to use their independent judgment to care for their patients. Another thing, the contracts might be made for 3 to 5 years, but what happens after that? What's to stop the hospital if they say, oops, we're really running out of money, we're going to lower your pay? So I think these are very dangerous setups for physicians to sell their practices to hospitals. I believe that the hospitals don't represent anything close to a free market. They're, in fact, the false economy. Nurses, employed physicians, and administrators get well reimbursed from the hospital system. The political connectedness is a big element in deciding whether the hospital will succeed or fail. And then what happens when the dollar crashes? What happens if the federal dollars just stop? What will these entities do? Our government is spending $1.40 for every dollar it takes in. Entitlement spending alone on Medicare, Medicaid, Social Security, and disability comes to $7,200 per person in this country. And that's every year. We're just spending that much money. Totally unsustainable. The money flowing into the hospital is huge, but look up in the upper left-hand corner. You've got the forgotten man, the taxpayer. And that's the one that has been totally left out of the equation when everybody else seems to be kind of happy with the current system. Taxpayers are getting fleeced. Speaking of entitlements, my interest has been the Medicaid system. So I've tried to analyze it in great depth, and here's what I found. If you go to statehealthfacts.org, you can look up any state and any government program, and you'll find that in New Jersey, Medicaid takes up $10.7 billion, where our whole state budget is $33 billion. And it's pretty standard across the nation. That's kind of the ratio. California, where we happen to be right now, Medicaid costs a whopping $42 billion. Their whole state budget is $92 billion. It's an amazing number. And that doesn't include welfare, food stamps, the other government programs that are given to the poor. It's just a huge amount. Medicaid system in New Jersey pays physicians at the lowest level in the country. Even managed care pays poorly, so doctors don't choose to enroll in Medicaid at all. Because of the frustration of patients being unable to find a physician who took Medicaid, in 1975, the Community Health Center program was set up under 330 of the Public Health Service Act. And actually, there's 1,200 such federally qualified health centers. Well, I've looked into them, and I don't think they're very honest or transparent either. They get lots of money from the different levels of government. They get enhanced Medicaid patients and, payments, and they get money from the federal government. They get huge grants, $600,000 in federal startup, and all these clinics love to get started up. There's a federally qualified health center in New Jersey where one of the senators is on the board, and he says, yeah, he goes, they do waste money. The one that he's on got $2 million extra, and they knew that they would lose it if they didn't spend it, so they just put an extra floor on their building that they didn't need. Anyway, health centers are another example of a false economy. That's the federally qualified health centers, FQHCs. And there's one in our neighboring town that has a budget of $15 million. Contrast that with a non-government free clinic, of which my husband and my husband's over here, and we started that in 2003. We see the same type of patients that would be Medicaid patients, but we could do it at a fraction of the cost. And they come, they get a kind reception, all volunteers, volunteer physicians, all volunteer nurses and staff, and we treat them as our neighbors that need help temporarily, and when they get better, they go on their way, and they don't need us anymore. There's no CPT codes, no ICD-9 codes, no billing. All of that just takes up so much of our time is eliminated. Medical students love to come and shadow us. They get to see a lot of pathology in a short amount of time. The cost to provide care in the Zarephath Health Center comes to about $15 a patient visit, none from the taxpayers. And the human interaction is therapeutic to both the giver and the receiver of care. The cost to provide care in a federally qualified health center is $150 per patient visit. With ours, it's just $15. And $15 million, our whole budget was $60,000 last year. Last week, John and I, along with 5 other volunteers, attended a wedding in the park. The reception was in the VFW building, and this was a remarkable event because we'd first met this couple at our clinic when they were in severe distress. The bride was running to escape from an abusive husband, and her boyfriend was in and out of jail for some reason or another. They were homeless, they were working odd jobs, and they would just come to the clinic, and we would see them. And then we have a clothing and a food pantry next door where they would get help. And here, 5 years later, they're getting married. The groom got the suit from our clothing pantry, and we got some, somehow they got the wedding dress too. We gave them some food and some sparkling cider for the reception in the VFW. But it was real charity, and there were 7 of us volunteers from the different charities that came, and they just loved us. They are so grateful to us, and they're starting to get involved in the church. Something sinister is going on behind the scenes, and there's a concerted effort to end the private practice of medicine. I've heard some people talk about this a little bit. And let me explain to you why. In 2000, 5% of the specialty physicians were employed by hospitals. Today it's 25%. And medical students have up to $200,000 worth of debt, so it's getting hard to start a private practice. I hope that some of you have spent some time reading Jane Orient's newsletters. I find them excellent every time I get them. I read them online, and I read them in print when they come. But this latest one, the latest one was called Do No Harm, and it was fascinating. She talks about the Hippocratic Oath, and I went back and looked at the Hippocratic Oath that my son read when he graduated from medical school this May. Here's the original. Before they altered it, I will give no deadly medicine to anyone if asked, nor suggest any such counsel. But the one that was recited by my son and the other medical graduates, and I just kind of looked at it and didn't really sink in what I was reading, It was led by Dr. Peter Carmel, president of AMA, who happens to be up at the school where he is, in New Jersey Medical School. I will give no drug, perform no operation for a criminal purpose, far less suggest it. Can anybody tell the difference there? Why do you think they took the trouble of changing a perfectly clear sentence? It wasn't a matter of using modern language. No, they wanted to change it on purpose. So if the state says it's okay to use medicine to purposefully cause the death of a patient or to kill him, will we physicians agree? Changes are subtle, but let's see. Consider Great Britain. Physicians there are employees of the National Health Service and have been since the early 40s. The government is responsible for paying for everyone's health care, so people just make an appointment. Well, demand is infinite, and they only have a decreased amount of supply, and the economy of England is not doing that well. So the National Health Service has developed something called the Liverpool Care Pathway, or the LCP. The Liverpool Care Pathway was first developed at a hospital in Liverpool, and the intention was to make the final days of cancer sufferers less painful and and decent. And we all know about hospice, and it's a good thing. Patients are heavily sedated, water and food are withheld. They die on average in 33 hours. Okay, so far so good. In 2001, it became a recognized model of the NHS. And then in 2004, it got approved by NICE, the National Institute for Health and Clinical Excellence. Talk about a euphemism. Well, its use has spread from cancer sufferers to all patients. Here's the problem. The LCP has become an assisted death pathway rather than an assisted care pathway. People who are not terminal have been targeted for LCP. And some of the reasons are bed sores, difficulty with nursing, mental confusion, or difficult to manage elderly patients. Dr. Patrick Policino, a British neurologist, he brought this to the fore, and he says, you know, there's a lot of people that are dying in the LCP that really should not, or they weren't terminal. And families, if you Google the Liverpool Care Pathway, and you look at the story, and then look at the family comments. And the families are horrified. The patient was talking to them, and they went back, and the patient was asleep and wasn't waking up and never woke up. So the patients are feeling, or the family members are feeling terrible that they let their family members go into the hospital. In England, 29% of patients who die have received the LCP, and that comes to 130,000 people per year. So what does that have to do to us? Hey, we're America. We would never do anything like that, right? Obama nominated Dr. Donald Berwick to run Medicare in 2010. And in July 2010, he appointed him to do the job while in Congress was in recess. The Republicans fought him. They got some idea that he wouldn't be very good in that position, so then he ended up withdrawing. And he didn't serve beyond 2011. Why the uproar? Well, he spent several years in the UK, and he loves the NHS. Why does he like it? He likes decentralized decision-making, enlightened decision-making. He mocks any system where ignorant, ill-educated patients decide what treatment they will get. He doesn't believe that patients, or even their doctors, have the capacity to see the bigger picture and look at global budgets. Berwick is very impressed with NICE. Here's what he actually said. The more I've studied it, the more I believe that less discretion for doctors will improve patient safety. Doctors will hate me for saying that. If we can't trust the discretion of doctors who spent their lives learning about the human body and what to do to remedy illness, who can we trust? Dr. Berwick is seriously misguided. Impossible for one man to control a health system with over 300 million people. Why should we expect anything different in the United States if the Liverpool Care Pathway is being done in England? If Obamacare stands, we're going to have the Independent Payment Advisory Board. You've all learned about that with the 15 unelected people who are going to decide who gets what kind of care and then who gets denied care. Well, physicians won't be denying the Hippocratic Oath if they do what the government tells them to do. How should we provide the best medical care in a time of scarcity? Okay, here are just some of the suggestions that the AAPS would endorse. Repeal Obamacare. It is going to destroy the finest health care in the world. End the IPAB. End the government mandates on insurance and allow people to buy the coverage they want from the state they want. End the tax incentive for employers to buy insurance and allow people to buy insurance at a young age and just keep it no matter where they work. Restore the free market to medical care. As I was saying, just let the doctors compete on price and quality and bedside manner, and their friends will tell them who's a good doctor. And the other doctors, a primary care doctor, knows who's good in the area in each specialty. And the crony capitalism that pays more to hospitals than private doctors for the same service. Replace the Medicaid system with real charity. Let me quickly tell you what we're doing in New Jersey. The Zarephath Charity Healthcare Act is now called the Volunteer Medical Professional Healthcare Act. We plan on establishing non-government free clinics with the Federal Tort Claims Act medical malpractice coverage for volunteer medical professionals. That's already been done. What we do in our free clinic, we are covered for by the federal government. Then we're going to ask doctors and nurses and dentists to simply volunteer to take care of the poor for free for 4 hours a week for primary care, 2 operations or deliveries a month for surgical specialties. This would cost the taxpayers absolutely nothing. We're volunteering. And it'll remove a huge bureaucracy from them. Then we're going to ask the state to extend the medical malpractice protection to the private practices of physicians who donate their time in this way. As is now, doctors who are too stressed, they're too stressed economically, emotionally, and in all ways to do much volunteering. Because my husband and I are too, we can manage our private practice and do the clinic, and we're able to do it, but a lot of doctors just find that they can't, and I'm not blaming them. But volunteering in this way would put the doctors, not the administrators, back in control of the care of the poor, and that's where it should be. Taxpayers would be the huge winners. And we need to stop thinking of the poor as people who are entitled to government programs, but instead just our neighbors who need help until they get back on their feet. They don't need Medicaid, they need medical care. And who can argue with free? Well, we believe we have enough bipartisan support in New Jersey from among the 40 New Jersey state senators to pass the Volunteer Medical Professional Healthcare Act. And we have a common sense answer to taking care of the poor. It's a model that absolutely works. For 12 hours a week, between the two of us and other volunteer physicians, we see 300 and 400 people per month. And as I said, $15 per patient visit. Lots of volunteers are helping, and it's something that we can accomplish. Let me tell you, as of yesterday, I found out that the bill is S2231 in New Jersey. And we're going to give out copies of the bill that was just posted. It'll actually be online probably tomorrow. It's posted in New Jersey because I said we have bipartisan support. We got the majority leader of the Senate, we have the minority leader of the Senate, and it's 40 senators, and we have 23 that are in favor of this bill. They're up against a hard deadline of this whole Medicaid thing being expanded under Obamacare, and the states are just reeling in the prospect of making it so long. So that was actually from another, that's from our Dr. Lee Heeb. But cash, complete transparency, catastrophic insurance without government mandates, and charity, real charity, is going to be the way we're going to pull ourselves back from the brink. Thank you.